so I'm going to be talking about positioning and attachment. One of the biggest fears that women have surrounding breastfeeding is the pain that breastfeeding causes. Now, 99% of the time, this can be taken away by effective positioning and attachment of the baby. If your baby is not positioned and attached well at the breast, then yes, there will be pain. So I'm going to go through effective positioning and attachment. Now, if we understand how a baby takes milk from the breast, that can really help. Okay, so your baby actually goes on the breast and squeezes the milk like this, and the nipple is actually down the back of the baby's throat, and so we're squeezing the breast like so. If your baby just goes on the end of the nipple, then there's less milk transfer, plus as well, this is when we get sore nipples. So we need to be enable the baby to get as much breast in the baby's mouth as physically possible. Okay, so by doing this, okay, I've got my baby here. Just move back a bit. Now what we need to make sure is that your baby is in nice and close to you. Okay, they like to feel really secure. Often their feet like feeling really nice and secure, and we want your baby's head and body in a nice straight line. Often what we see is babies turned on their back with the head going this way. Now if you imagine when you eat your tea, your dinner is placed in front of you. If somebody put your dinner at the side of you, it would be difficult to eat. So our babies are exactly the same. They want to be looking at the food. They want to be seeing their food. That's exactly what we do when our babies are the same. So our babies turn nice and inwards, nice and close to you, with their feet nice and secure. And we use the opposite arm to the breast that we're feeding from. And as you can see here, what I'm doing is holding the baby nice and secure round the shoulders, but so the neck is free. We're not holding the head like this, okay? Because imagine someone holding your head. If you're eating your tea, you wouldn't like it. Same goes for our babies. So we want their neck nice and free. Now what this also encourages is your baby to be able to tip their head back nice, and so they can have a nice wide mouth, and so they then will be able to get more breast in the mouth. So baby in nice and close, looking at the food, feeling nice and secure, hand round the shoulders so that neck is nice and free. Now where we need to position the baby's head at the breast is nose to nipple. Okay, so if we have the nose to nipple, what happens is this. So we have the nose to nipple. It's more kind of like the nipple going up the nose. So that neck is nice and free. When your baby opens their mouth, they are then in a really good position to take the breast in the mouth. If we start directly here, when the baby opens their mouth, they're not going to reach it, or what they could end up doing is this, and this again is not effective attachment. So it's really important that when your baby's looking at the breast, we've got that nose to nipple. So your baby's in nice and close, around like so, feeling nice and secure, hand across the shoulders, that neck nice and free. And then what your baby will do, they'll rub that nipple, that nose on your nipple, and this can encourage them to start to open their mouth. Now when they've got a nice wide mouth, what we do is bring them on quickly to the breast. Did you see? So when your baby has a nice wide mouth, really quickly onto the breast, because as soon as they set their eyes on that target, vump, they're on it. Okay, so anything other than a large wide mouth, try not to attach your baby, because what will happen, they will just go on the end of the nipple, and this is what can create soreness. Now when your baby goes onto the breast, you should see nice full round cheeks, because those cheeks are full of breast. If your baby's mouth is going in, if you can see their cheeks sallow as they're sucking, then guaranteed they're just on the end of the nipple. And again, this is what we don't want. So unlatch your baby, take them back off and re-put them back on. So we're getting lots of breast in the mouth. Now, when we're bringing baby onto the breast, it can often help as well if we hold our breast. So there's a nice round shape to that breast, so it's something good for the baby to go onto as well. So just remember, what we want is your baby in a nice straight line, okay, but their head turned in, looking at their food, feeling nice and secure, the opposite arm to breast, your hand across the shoulders, their neck nice and free. So what they can then do is tip their head back. And of course, what we're going to be doing is that nose to nipple. So when your baby's head moves back, we bring them, holding the breast, we then bring them on quickly. We see those nice round cheeks, and a good positioning and attachment as well can be seen if the majority of the areola is above the top lip. They'll do very quick sucks first of all. This is encouraging the milk to the forefront of the breast, and then they'll go into long, deep sucks. So they start off very quick, and then they go, stop, go, and then they stop, and then they stop. Okay, so this is totally normal. They don't have to be feeding all the time. Okay, so yes, positioning and attachment is just so important, and it can help so much. So if we get this right in the beginning and understanding how much breast a baby needs in the mouth, then this can help avoid those sore nipples. But once again, if you are experiencing any pain, then this is not right. So please go and see someone who will be able to help you. Perhaps they can go through that positioning and attachment with you again, or there may be something else you know, that may be causing this pain, and we can look into it more. But breastfeeding should not be painful. Okay, so I hope the positioning and attachment video helps. Thanks. Bye.